FM 91.3. This is the Morning Drive with Carrie and Lynette. How is your morning so far?
Well, I think I'm about to see clearly now.
I can see clearly now. The rain is gone.
Okay, not karaoke session, because we're going to be speaking to a professional, okay,
Yes.
a medical professional. Welcome, Dr. Aaron Ng Wei Wen from Tock Seng Hospital. Hello.
Hi, good morning. Thanks for having me here.
Morning. Dr. Aaron Ng is an associate consultant from the National Healthcare Group Eye Institute at TTSH, and he's here to talk about caring for your aging eyes, particularly cataract, right? So, as we get older, the changes in our vision, what are some of the more common eye problems aside from cataract, that come with age?
Yeah, so as you get older, your tear film quality tends to degrade, and so older people tend to complain of dry eyes.
Yes.
And also, as you grow older, the natural ability of your crystalline lens, which in a young patient tends to be very dynamic and allows you to focus at multiple distances, gets affected. And so you lose your ability to focus for near objects. That's called presbyopia. In Mandarin, they call it 老花眼.
Old flower
Yes,
eyes.
old flower eye. Yes, you're right. Then, of course, you have cataracts. Cataracts is an opacification of the natural crystalline lens, which affects the quality of light that goes into your eye and gets focused on the retina. Behind the crystalline lens, there's a space called the vitreous cavity. And this vitreous cavity is filled with gel-like substance called vitreous gel. And this vitreous gel tends to degrade over time, and it forms clumps in the vitreous cavity. And what patients tend to complain about is floaters. So I'm sure you've heard of that as well. Yeah.
Yes. So not complete blockage, but just like little bits.
Yeah, little bits like
your...
cobwebs or mosquitoes or flies that they cannot swap away.
What color is it? Is it whitish or is it
usually
blackish?
it's black because there are clumps of particles within the vitreous cavity that's moving around, and they are actually shadows that are being formed because as light passes through, it's being blocked by that little clumps, and it's then the patient will see as a floater because it's a shadow that's cast on the retina.
Okay, so but that's not cataract, right?
That's not cataract.
Okay, but will it develop to cataract?
So there are two separate things.
Okay.
They are sort of not related, even though at this quite a similar age group they tend to develop. Cataract is an opacification of the lens that can be by any means. Cataract is most commonly seen in the elderly. So as you get older, your natural crystalline lens will tend to become more and more opaque and affect the quality of light that enters your eye.
Yeah. Although, doctor, I have heard of people in their 40s getting cataract.
Really?
Yes.
Are you sure?
Yes. It's happened to some of our colleagues here, which is kind of rare, right?
Yes. So generally it's age related.
Okay.
It starts at about maybe 40 plus, 50 years old.
Okay.
If you were to see an ophthalmologist for opinion on maybe something totally different, like let's say floaters, and then I see, maybe your lens is a bit discolored, I might just say, you have a little bit of cataract. But most patients have perfect vision at this age group.
Yeah.
They have no complaints. Then again, there are other causes of cataract as well. So people who rub their eyes a lot tend to get cataract at an early age. So we have a lot of patients, not say a lot, but a number of patients who are in their 20s or 30s and they have very bad eczema, for example, and they have been habitually rubbing their eyes since they are young. So these patients tend to develop some form of cataract at an earlier age. Sometimes people on long-term medical treatment like steroids, or they have had trauma to their eye, direct trauma, and that also can cause cataracts to come at an earlier age group.
Okay.
I also heard that staring at the sun for too long can also develop cataracts.
That one you can go blind.
Yes.
Okay, but we'll come back to that in just a little bit.
We're going on
For
Facebook.
now,
Yeah, so join us there, okay, with Dr. Ng.
Just up.
Okay, so staring in the sun, it's just bad in general for your eyes, right? So don't do it, Lynette. It's not just about the cataract.
Don't do it, Lynette.
Okay, so the first signs of developing cataracts is just that you can't really see clearly. Is that it?
So the most common complaint would be blurring of vision. Blurring of vision can, patients may describe it in various forms. So foggy vision, contrast not so good. At night, can't see very well. Generally for cataracts, the onset will be more gradual. and also progressive in nature. So if you wait for a year or so, you can feel that it's going worse and worse.
Okay.
Other things that patients may complain about is glare and halos, especially when you see bright lights. And uncommonly, once in a while, we do have patients who come in who needs their spectacle degree changed multiple times a year, and usually in the more than 50 to 60 year age group, and that may be a sign that they may actually have cataracts that's causing a change in the degree.
Yeah, because I was thinking when you talk about lights and all that, I was thinking that is also closely related to astigmatism. Can it be confused with that sometimes?
Yes, it can be confused.
Yeah.
So the medical eye care professional will have to then check and determine what is the exact cause of your complaints, and then to pinpoint it and treat it accordingly.
Okay. So if somebody finds out that they have cataracts, is surgery the only way out? What can they do?
Yeah, so unfortunately, surgery is the only definitive way to get rid of a cataract. Fortunately, surgery is generally a fast procedure, and is generally has good outcomes across the board. So patients do get back a very, very good vision. Also, it doesn't mean that just because you have a cataract, you need to go for surgery. Like I said, most patients come in for other issues and say, oh, by the way, you have cataract. If you're totally asymptomatic and the cataract is otherwise causing no other problem, it may not be a time for you to go for cataract surgery, and you may usually operate on patients who have visually significant cataracts.
Yeah. Okay, so you can wait it out.
Yeah, in most cases.
Cases. Okay, we've got a listener who asked, is it necessary to treat the floaters?
Okay, that's a very common question.
Yeah.
So floaters are a symptom. The most common cause is vitreous degeneration, which I explained just now. However, sometimes floaters can be due to other more insidious conditions like retinal tears or detachments, and these are potentially blinding conditions. But they are not as common as the most common cause of floaters. So you should get checked to make sure that you don't have a retinal problem. And if it's not a retinal problem, then good for you. Then it's probably just due to vitreous degeneration. And in most cases, we don't really offer any kind of treatment because it's a symptom that people tend to get used to over time, and they get used to this. Their brain gets used to and adapts to the fact that there's a little bit of floaters in our vision. Of course, there are certain therapies that may be available, especially now people read the internet and things like that. But generally, a bit controversial because element of risk involved for otherwise. For something that you may not actually need treatment for.
Yeah. So go check with the doctor. Don't ask ChatGPT or TikTok, okay?
Oh,
don't
please
seek
never.
medical counsel there.
And don't Google also.
Yeah. Okay. So after cataract surgery, right? Does a patient see clearly immediately? What happens after that?
Yes. So for cataract surgery, usually patients get improved vision in the first few days. Of course, cataracts, while we use it as a unified term, actually cataracts come in many different forms, shapes and sizes. The anatomy of the eye is different. Some patients may require a slightly longer period of recovery in order to see better, but eventually they usually do, even if it's very bad, usually after a few months they will be able to get back their best visual potential.
And do they still need glasses after that, after surgery?
That's a very good question. So a lot of patients ask that. Two things. So firstly, remember that we are taking out the cataract and putting in an intraocular lens in the eye to replace the natural crystalline lens. And so the lens power is different for different patients and different eyes. How do we determine the lens power that has to be put into your eye? We do some tests before the surgery, and then we guess what kind of lens power you need. And guessing is like a prediction, and every prediction has an element of error in it. So it's not like LASIK per se. So there will be a little bit of degree that you get back, but most patients will be able to see quite well without glasses. Some people ask about presbyopia correction. They want to see far, they want to see near, they want to be even better than what they were before cataract surgery. That is possible because there are new strategies and also new higher technology, advanced technology intraocular lenses that can be used nowadays.
I have a girlfriend who actually put in two different lenses. One that allows her to read near things, and the other one allows her to drive, see far.
Yes.
So how does that work? Does it work out? Does the brain get confused?
Yeah, so luckily you have two eyes. So what you have described is something called monovision.
Yes.
Monovision, that means you see one eye for far, and the other eye usually would target near or intermediate. That is a good compromise. because then you're able to see pretty well at multiple distances without necessary some of the side effects or the compromises that you have to make if you were to choose a lens that is a multifocal lens.
That's true. You know, currently I'm wearing exactly what we talked about. My left eye allows me to see near when I'm reading, and my right eye allows me to see far when I'm driving.
So this woman has been trying to persuade me.
her.
Hey, go and get your glasses done like this. I'm like, are you sure you won't get headache or you get just kind of some
it's so
confusion.
good. It's so good because you don't have to keep like putting it on and take it off. You know, you can see near and see far at the same time.
Okay. So we're talking about cataracts, right? Are there, aside from that, are there other age-related, problems that people should be aware of or get checked for?
Yeah, so usually we want to check things that are generally quite common and things that we want to intervene at an early stage so that it doesn't affect your vision permanently. So you can treat these diseases before they cause you irreversible harm, right? So things like glaucoma is pretty important. Glaucoma is the sort of nickname is the silent thief of sight. So patients may have advanced glaucoma and they don't notice it until a very late stage before they come and seek medical treatment. So that's something that you may want to get your eyes screened for when you're of a certain age. The other thing will be age-related macular degeneration. So that can also affect the vision. The macula is the center part of the retina, which contains the most number of photoreceptors, which is in charge of central vision, sharp vision, and color vision. So if there's degeneration of that part of the retina, then patients can potentially go blind.
Okay, wait. I want to talk about glaucoma because I've heard that word come up. In fact, my dad's friend went blind because of glaucoma. I wasn't treated, but what are the telltale signs that you have glaucoma?
All right, so glaucoma is a term which encompasses many. There are many different kinds of glaucomas. I think, of course, there's what we call urgent glaucoma, where there's a glaucoma attack, and in these cases, the eye pressure will be very high suddenly.
So there's pain.
There's pain. There's blurring of vision. Some patients come in with headache. Because the eye, they may not complain of pain, but they complain of headache and nausea and vomiting. That's because of the high pressure in the eye, and these patients need emergency medical attention to bring down the pressure as soon as possible before it harms the optic nerve. The other kind of glaucoma, which is insidious and patients may not notice about, is just the regular glaucomas where the pressure is sort of high or even normal, but not high enough to cause you pain, because patients come and see doctors for pain and not necessarily for blur vision. You know, blur vision, sometimes patients tend to think they can wait. And glaucoma affects the side vision first. Not the center vision. So it's very hard to tell because people don't really measure their sight vision or cannot tell if their sight vision is getting affected at an early stage.
This is very evil. That's why it's insidious. You won't know. How can you tell?
Exactly.
Okay, we're going back on air right now. Let's chat more there. The Sounds of Blue with One Love here on 1FM 91.3. Here today on a Thursday morning, we're joined by Dr. Aaron Ng. He is an associate consultant from Tock Seng Hospital. Thank you so much for being here with us, Dr. Ng. So we were having a really robust chat about cataract and also a little bit about glaucoma, which sounds quite scary. So telltale sign is peripheral vision, as it starts to be affected first.
Yeah, peripheral vision is usually what's affected first. However, peripheral vision is hard to tell. You can't really, you don't go and like put your fingers to the side and try to compare it. And who do you compare to, right? So usually my advice would be to get eye screening because that's probably the most effective way to detect glaucoma early on. And you want to why you want to detect glaucoma early on, because glaucomatous damage to the optic nerve is actually irreversible.
Okay, so how regular or how soon do you think somebody should get their eyes checked? Like going to the dentist, people say, okay, every 6 months. Do we get our eyes checked every 6 months or a year, every year?
Yeah, so I think it depends on the risk, but for just a normal person with no significant, special risk factor involved, Generally, I would recommend maybe every 1 to 2 years you should get your eyes checked.
And then for the elderly, like
yeah, so starting about 50 to 60 years old, you can get your eyes checked.
That's me.
Yeah.
And also, aside from those regular checkups, what other tips and tricks can you share with us? How can we take care of our eyes as we age?
Yeah, lifestyle, diet, supplements.
Yeah, so supplements, a lot of our patients take supplements. Actually, no real evidence to show that really supplementation really enhances and protects your eyes if you really, especially if you have healthy eyes already and that you have already a very healthy, balanced diet. So a diet rich in green leafy vegetables, fruits. These have a lot of antioxidants and also carotenoids which help nourish your eyes. Omega-3 is good, so some of the fish oils are good. Generally, we don't recommend a lot of red meat in your diet and processed food in your diet. Other things is like cardiovascular health, so stop smoking because there are blood vessels everywhere in your body, including the eyes. So anything that affects your blood vessels will affect your eyes as well. Singaporeans tend to not wear sunglasses generally compared to people overseas, but that is quite important in protecting your eyes from UV rays.
Okay, so go and buy a nice cool pair of sunglasses. Okay. Aside from that, exercising, taking care of your eyes, going to get your eyes checked, right? Every 1 to 2 years, according to Dr. Ng. Should take care of your eyes and of course, be very careful with them. If you need, any consultation, I think you can head over to Tock Seng Hospital. Look for Dr. Ng, but thank you very much for joining us
Thank you
here.
very much.
Thank you so
Dr.
much.
Aaron Ng Wei Wen from Tock Seng Hospital.
1FM 91.3.
It's Thursday, the 26th of June.
1FM Day Check by Gain City. Gain City's dangerously big sale. Get $40 off every $500 spent and an additional $160 off. No cap on discount. Terms apply. Shop at Gain City today. Jurassic World Rebirth